environment. This is actually an excerpt of a presentation. So I'm not sure, are these presentations available to everyone? Or they will be. This is an excerpt of a presentation I did for the Michigan State Medical Society a couple months ago, where we did an online webinar that you can go out and play back. So if you're interested in the full deck or want to hear the discussion around that, that's available from the Michigan State Medical Society site. So within healthcare, we've seen a number of breaches. These are all within the last 12 months. So this one, employee accesses 10,000 patient medical records. Healthcare.gov, right? And the point really on this one was what you hear more and more in the industry, and because of the intelligence and the complexities of the attacks, is the duration of that attack from the time it started to the time it was actually detected. So the criticism for the healthcare.gov wasn't so much that they got hacked, it was how long it took them to realize they got hacked. Altamed Health Services, sorry Brian, I can't see this very well. 3,000 patient records from a rogue temporary employee for identity theft. FBI sent a warning to healthcare providers, this was last year. St. Vincent Breast Care, 63,000 letters to the wrong people. So, you know, that sounds ridiculous, and it kind of is from a privacy perspective. But having worked for a financial institution where we sent letters out often, I can understand how this can happen, because you send, 60,000 letters, you get one of them out of sequence, all of a sudden they're all going to the wrong people from that point forward. So not that it's an excuse, but at least I can understand how it can happen. This is a good example of what not to do. So this was an actual photo taken, and there was another one, I want to say a few weeks ago, that I seen in the news media, very similar situation. So this was a healthcare practice that either went out of business, moved, whatever the case is, and just decided to take all their physical paper files and dump them in a dumpster. Then community health was the big one last year. Until Anthem. And some of these incidents bring up areas of cybersecurity that, or I would say are areas that aren't necessarily cybersecurity, but are practices that you have to have solid in your company. With Anthem, or if we go back to community health, if we think about Home Depot, we think about Target. Some of these were from third-party vendors. The whole Target breach stemmed from a HVAC vendor that serviced Target. And so, we can do all we want in cybersecurity and trying to prevent, but you've got to have good vendor management practices as well, right, amongst a number of other things. But Anthem was huge. I was one of the affected customers, so obviously that one hits personal for me. And this is just a nice graphic. There's a site out there called, I footnoted it, I think it's called Data is Beautiful, which does some nice representations of, in this case, data breaches, industry, size of the breach, determines the size and shape of the circles there. So from a healthcare perspective, you have to understand where the business is at. And I would say in 2015, the need for that security officer like myself to be in tune with the needs of the business and what the business does and how they operate is more critical than ever. Because ultimately, we need to enable the business. We just need to enable them securely. So in order to do that, you have to understand the goals of the business. And in healthcare, from a healthcare provider perspective, where I'm from, it's patient care. That's primary, right? We are there to treat patients. On top of that, quality and safety, right? We can't afford to make mistakes where people may die because of them, and so we run that risk in healthcare. Real-time access to information regardless of where the data is. So there's a lot of good momentum and philosophically a lot of good activity towards accountable care and around providing the best care possible at that point of treatment. And that's regardless of where you are. So if I decide to go on vacation next week, I wish, and let's say I'm in Phoenix, Arizona, and something happens and I end up in the hospital, the expectation is that they should be able to pull up my records in Phoenix, Arizona, right, regardless of where my physician is or what hospitals I've been seeing in the past. Is it there yet? Not really, but it's getting there. And it's a noble goal to be able to do that. But that certainly presents its own challenges around protecting data. So I'm going to try and breeze through these a little faster because I got to give these guys time to speak. So flow of data needs to be seamless. Medical devices, almost all of them are connected. If I walk down the hallway of one of our hospitals, almost every device that I see is on the network. You know, whether it's, heart monitors, whether it's infusion pumps, all them things are networked today. iPads, iPhones, and tablets. In the healthcare environment, that's not something you can say no to, right? You can't say, nope, we're not going to allow BYOD. We can't do that in the healthcare environment. And I can tell you why, because at Beaumont, 70% of our physicians are not direct employees. They're private practice physicians. So they have their own assets. They walk into our hospitals with their own assets and need to be able to treat their patients. And so we have to enable them to do that, knowing that they're not on a corporate controlled device. So running through some of these, trends in the healthcare industry, I think as Cynthia alluded to, healthcare data has been mentioned to be the most valuable out there. I have my own suggested reasons as to why that is, but a couple of the big ones, Medicare and Medicaid fraud. So think about having a whole set of patient records. You put up a fraudulent business out there that says you're a healthcare provider and start billing CMS, right, for services. It could be very lucrative if you can get away with it. Yes, there's always the risk of the patients that walk in and pretend to be somebody else because they want, they need care and they don't have insurance. That happens all the time. But those are certainly less risky than the mass attacks that you may see. So phishing, still the easiest mode of attack. And to Cynthia's point too, right, some of the issues that we have to deal with are the users. We can have the best defenses out there. Firewalls, these integrated threat appliances, fantastic monitoring. But if users get phished and they provide their credentials, that is really difficult to detect because now these intruders are coming in with valid credentials. So let me skip through some of this. The OCR and CMS, I've said in the past, there's not enough regulatory monitoring. There's enough regulation. HIPAA's a pretty decent regulation, right? But there needs to be better enforcement. When I was in financial services, we had constant oversight by our regulators. I've been at Beaumont for 3 years. I have yet to ever speak or see anyone from the Office of Civil Rights. So some of the challenges, we talked about the first one a little bit. So much data flows outside the organization on a daily basis. You'd be amazed at how much patient data we're pumping out of our environment, whether it's to the health information exchanges, whether it's to other entities because they're requesting the records. If I am in Phoenix and they're pulling my records, There's a tremendous amount of data we send out to health consortiums. So it's just staggering the amount of data we put out there. And medical device manufacturers aren't helping. So they, have traditionally, some of them have taken stances that, hey, this device is FDA approved and I'm not going to touch it. I'm not going to put anti-malware on it. I'm not going to do anything because it's approved the way it is. And finally, last year, there was some guidance put out by the FDA that said, no, that's not the intent. We expect you to secure those devices. But a lot of them still haven't stepped up to the plate. And what the challenge that I'm seeing right now is with Windows XP being out of support now, I've seen a number of requests from the business folks at Beaumont that are now wanting to buy medical equipment because these guys are putting it out there for sale cheap because it's using operating systems that we don't want in the environment. But they're all gung-ho, hey, look, I can get a great deal on this. So President Cheney, Vice President, excuse me, a couple of years ago announced that he had the wireless capability taken out of his pacemaker when he was in office because he was afraid of somebody hacking it and killing him. And I think later that same year at the RSA convention or the Black Hat convention, they proved that that could be done. The one thing I will reiterate over and over and over again, we have a new CEO at Beaumont that joined us a few months ago from Emory Healthcare in Atlanta. And I had my first opportunity to provide him a status of our information security program on Wednesday. And I was very glad to hear that he has a very strong passion for awareness, just like I do. Back to phishing being the most prominent type of attack out there because it's easier to phish people than it is to hack. There's a tremendous amount of progress that you can make in your security program by just education. Educating the users, testing the users, putting things like data loss prevention in place where if they try and do something, they get an immediate alert. Okay, you look at that as a cybersecurity capability. I also look at it as an awareness activity because they know right at the point that they're trying to do something we don't want them to be doing. And that's a great awareness point to catch people right at that point of doing it. All right, we can skip this. Am I out of time, Brian? So I put a top 10 list here, and this is really to just any kind of healthcare entity out there, even down to the physician practice. So first and foremost, have a plan, right? Start with a framework. There's a number of them out there. NIST has got frameworks. ISO's kind of the international standard. HITRUST has one specific to healthcare. Just use one of them and start with that. Use it as a framework. Second is understand your environment. Like I said earlier, understand your business. Understand what users and what equipment are on your network. Easier said than done, I'll tell you. Understand data flows, particularly those that are going off network. And then manage your vendors and business associates. Back to Target and a number of others. Right? Some of those breaches start at these vendors of the company, not something that your own business has done. Write easy to understand policies and educate. When I got to Beaumont, they had an information security policy. It was 110 pages long. One security policy. And my reaction was, do we honestly expect anybody to read that? Right? I wouldn't. I did because I had to, but if I was a user, I wouldn't. So cut them back to something that's more reasonable. If you need to write one specifically around access controls, write a 2-pager, right? Or a 5-pager. Don't write a 100-pager because nobody's going to read it. Leverage virtualization. So this is something we do extensively in healthcare. And as I mentioned earlier, we have all these physicians walking in with non-company devices. And so we leverage Citrix heavily. So we have them come in through an external portal. We have the rules set up so they can't copy, they can't download anything from Citrix, but it gives us a secure way for them to get in, and it helps insulate us from any malware or any other things that may be on that device. Manage the data. So this is my one plug for MDM or those types of solutions. I don't care about the phone itself. I really don't. I'm not interested in putting a PIN code on the device. What I'm interested in putting is a PIN code around the data. So if you look at my phone, I mean, I have a PIN code at the device level, but that's my choice that I put there, right? The MDM software we're using has its own container with my email and my calendar, and that's what's protected by from the organization's perspective. So I don't care if people are getting on their phone and accessing photos of family or texting their buddies. I don't care to protect the phone from that. What I care is protecting that container that has the company data. SSO, single sign-on with badge readers. I think Cynthia alluded to this also. It's all about speed in healthcare, particularly when you look at the emergency centers. So, making more complex passwords, they rebel against it. Right, and again, the focus is patient care, right? They don't want to do anything that's going to take them 5 seconds or 3 seconds longer, because that could have an effect on that patient that's in the room right now that I'm trying to treat. So we leverage badge readers with single sign-on. So they log on the first time, and then for the next, I think we have it set up for maybe 4 hours, right? They can just tap their badge to log in and out. So it's a much quicker process. One of the things we've been testing with Brian and his team is identity federation across entities, which I think is great. And when I think about companies like organ donation entities, that would be absolutely key for them, right? Because they got to log into multiple different entities. It'd be nice for them to log into one and be able to federate that identity across and have those trusts in place. So with that, we've tested out palm scanners, which is another, should be quick and easy way to authenticate. So, medical devices, yep, we talked about that. And just blocking and tackling. One of the things I found out in healthcare when I got to Beaumont was coming from financial services, there was a huge maturity gap between the level of the program at the financial service industry I was at to Beaumont. And so as an industry, I think healthcare still has a long way to go. Part of the reason we stood up the Cybersecurity Council back in 2013, and hopefully we can keep pushing that hard and trying to innovate and improve the overall industry as a whole and not just Beaumont. So I think we can skip the rest of these. You'll have the slides. I'll just flip through to get through them. But I'll go back to you, Brian.
Thanks, Doug.
Yep.
Good morning, everyone. Thanks for attending the conference. Thanks for attending this workshop session, and thanks for allowing me to present today. So I had slides that I was going to go through, but the two gentlemen before me did a really good job of covering some of the stuff that I was going to talk about, so I'm not going to use the slides. So you get to stare at my ugly mug for the next 10, 15 minutes or so. So my presentation, my talk is going to be sort of broken down into threes. So I'm going to talk about the three things that some of the top security companies are doing and when they're focusing on their security and how they're becoming more secure. So what are those three areas that work together? The three groups that we see target healthcare most often. And then lastly, three things that you can do to increase your security from where you're at today. So a quick background about myself. I'm a threat analyst for FireEye. So the good thing about that is no one really knows what I do, and I work from home, so it works even better. But as a threat analyst, the good thing is I work around go to visit our customers and our prospects and let them know what the threats are to their industry. So what threats we're seeing in the healthcare industry, what threats we're seeing in the financial industry, who are the attackers, what are their techniques, but most importantly, why are they trying to target them? So before that, I spent 6 years in Washington, D.C. I was a cyber analyst for the CIA, and my role is similar. So I was focused on what the threats were to the U.S. government, who the attackers were, how they were trying to get in. I spent the majority of my time focused on Eastern Europe and some of the countries out that area, and what they're trying to do to get into the United States and to get into different networks. From a technology standpoint, what are they doing? What are they trying to do to get into these networks? But from a political and an economic standpoint, what is the goal? What is the information they're trying to steal, and why are they trying to steal that information? So I spent some time doing cyber, spent some time doing an organized crime. Well, I wasn't doing organized crime, I spent time actually working on organized crime. I don't have to take polygraphs anymore, so I guess I could be honest about that. So I really get an interesting perspective to be able to see both the public sector side and the private sector side, and how the attackers change and how the attackers differ. So it's a really interesting perspective to see both of those areas. But so the three things that companies are doing that sort of, we look at sort of the upper echelon or the top sort of security companies, there's three things that they do and they really tie all together. So those three things are malware analysis, incident response, and then strategic analysis. So the malware analysis is what you would expect. So they're able to identify what sort of things are coming into their network, being able to try and block those, or being able to identify, being able to sort of get insight and visualization, being able to see what's going on in their network. But from a malware analysis perspective, it's also important to understand what the vectors are. So what are the infection vectors? So how are attackers getting into the network? The predominant way we see attackers get into a network is two ways: web, email. Email attacks are what you would expect. So they're sending attachments or they're sending malicious links. The links, when they click on it, goes out to somewhere else, downloads additional malware onto their boxes, they're getting infected. The web-based attacks are a little bit different. So when we talk about a web-based attack, what they're doing is attackers are infecting a web page that they're hoping that their end users or their victims are going to go visit. So it's one thing to say, yeah, NBC.com is serving malicious ads and there's an infection on there. But for targeted attacks, it's more like the attackers who are targeting a large healthcare company are going to target the company that maybe they outsource the IT to, or a company that they're working with in partnership for a conference, or a company that they're looking for mergers and acquisition. So my favorite story that I talk about when I talk about web-based attacks, I guess favorite is probably not the best term for an attack, but so the story that I used often when I talk about web-based attacks is there was an oil and gas company that we were working with down in Texas, and they had pretty good email prevention. They were receiving malicious emails, but none of them were getting through. They still saw infections, so they did a little bit more analysis, and they found out that their end users were going to a certain website and becoming infected by visiting that website. They did a little bit more analysis, and they found out that there was a Vietnamese restaurant located near the headquarters of the oil and gas company, that the menus and the special page were both infected, serving up malware. So when their end users were going to check to see what the menus were, the specials were, for that Vietnamese restaurant, they were getting infected that way. So again, more of a targeted attack. Think about the security budget of the mom and pop Vietnamese restaurant that their nephew probably set up their website, compared to this multi-billion-dollar oil and gas industry. So when we talk about a web-based attack, that's sort of what we're talking about. So the malware analysis being the first part, being able to identify what's going on in your network and how are attackers coming into your network. Second part's being incident response. So what are the attackers doing when they get onto your network? And the reason why incident response is so important, we sort of mentioned that in the previous presentation, but so of all the different engagements that our company, FireEye and Mandiant, had looked at last year, and it's over 200, and these are the big ones, the ones you hear about in the news. So of all the ones that we had looked at last year, of all the compromised machines that we had identified, roughly around 50% of them had malware on them, or viruses, or whatever you like to call them, only 50%. So the other 50% of compromised computers didn't have any piece of malware on there. So if you were scanning on user security tool, it's going to come up clean. But the attackers were using legitimate credentials or traditional Windows command lines to move across to these networks. So if you have an infection on computer A, and the attackers have moved to computer B, C, and D, and you only see the malware on computer A, and you take computer A offline, you don't do the incident response, you wipe that computer, put a new operating system on there, and put it back out into the network, it goes back to the whack-a-mole thing. You're missing how the attackers have moved from computer B and computer C and computer D. So you're really stopping malware, you're not actually stopping the attackers. So one of the things that we're able to see from incident response and all the different engagements that we had done is some trending things that have happened over the last 2014, in the last year or so. So the big difference that we had seen what attackers do when they get access to a network, excuse me, in 2014, is the first thing that they were doing is they were looking for VPN information. They were looking for VPN credentials. They were looking for VPN certificates. They were looking for how the VPN was set up. And the first goal is to find information about that VPN. We've seen attackers get access to a network with malware, get access via the VPN of traditional or legitimate credentials, and then remove their malware off the system and then just use the legitimate credentials. We see attackers getting around bad two-factor authentication as well. So in a sense that if you have two-factor authentication and you need a PIN or you need a password to get onto the network, but if you forget that PIN and you forget that password and you can click a button and have that emailed to you, well, the attackers had access to the email accounts, so they were just resetting everyone's PIN or resetting everyone's password and getting around two-factor authentication that way. But the big change from incident response that we had seen is when attackers get access to a network, the first thing that they're doing is looking for VPN and looking for legitimate access. So malware analysis, being able to understand what's coming into your network and the infection vector, tying that into the incident response, what are they doing when they move laterally throughout a network? And then the third part is the strategic analysis. Who the attackers are, why are they targeting you, and what is sort of the information that they're looking for. So when we talk about strategic analysis, focusing on what the groups are that are targeted towards healthcare, there's really three areas and three groups that we see specifically target healthcare. And those three groups are for money, data, or to steal from Batman to watch the world burn. So from a money perspective, we sort of talked about that. You can see the reasons why they want to steal personally identifiable information. They want to steal credit card information. They want to be able to quickly monetize a computer. But we also see them trying to monetize individual computers by getting access to a computer and then renting out that access. So renting it out so people can send spam, renting it out so people can use it to take down a website, renting it out so they can host their tools as well. So money is financially motivated. So money being one of the reasons why attackers target the healthcare industry. The second one is data. This is where you hear that overly used, super sexy APT term, the advanced persistent threat. So this is nation state actors who are looking for specific data from a specific company to solve a specific problem. These are the ones that can be in there for months, for years, for weeks, as long as they need to solve that particular problem. So money, data, and then to watch the world burn are sort of the hacktivists. These are the people that are basically a pain in the ass. They look to take down websites, mess up people's Twitter accounts, delete data, cause havoc, delete information, or post information out there. So three reasons we see healthcare targeting are money, data, or to cause a havoc, or to watch the world burn. So there's two groups that I want to just specifically talk about because they're sort of out of the norm of what we would normally see targeting healthcare. So there's one group who is a financially motivated criminal that we recently released a report about, what we call FIN4. And the interesting thing about this group is they're financially motivated criminals, but they weren't trying to steal personally identifiable information or credit card information. They were trying to steal intellectual property so that they could do stock manipulation. And they were targeting healthcare companies, they were targeting pharmaceutical companies, and they were targeting biochemical companies, but also mergers and acquisition companies. So companies who were involved with the mergers and acquisition, they were targeting both sides of the merger and the acquisition, and also the bank or the law firm that was handling both areas of that. And the interesting thing about this group is there's two ways that they were targeting users, and neither one of these were malware or a malicious piece of software. They were both email-based. The first one, they were sending out an email that had a link, and they were saying, I saw some information about your company. I think this may affect your stock going forward. There's someone bad-mouthing who says they have insider access. Click on this link for more information. The end users were clicking on the link, and the first thing when you click on that link, it pops up a Microsoft Outlook login and password pop up to make it look like, oh, I just got kicked off of my Outlook. Let me put my login and password back in there. Or my VPN kicked me off. Here's my login and password information. They were just taking that login and password information and accessing the network that way. The second way is they were sending Word documents that had malicious attachments in there. So if you sent me an email and I had access to your email, I would go through and see which documents you're sending. And I wanted to target someone else in your company. What they're doing is they were taking those documents that had been sent out and just weaponizing them and forwarding them on to other people within the company saying, FYI, or I forgot to put you on this, or this might be of interest to you. And when you open up those documents, there's a Visual Basic script on there that, again, pops on your Microsoft Outlook login and password information. So when you log in that information, and what they were doing is they were getting access and just reading email. They were just finding out what the trades were going to be, how the company's technology is changing, how the tests that they're doing, so that they can manipulate stock. So not malware in the loosest sense of the term, but they're still attacking for financially motivated access, but not to steal personally identifiable information. So the second particular group that we see target healthcare is China. No surprise there. We could probably spend all day talking about that. I'm sure the FBI's got some great stories that we can have some beers and talk about. But from a China perspective, it's the same thing. They're looking for intellectual property, but this is more of a long-term target. So they're looking for information to solve some of their long-term goals. And the good thing for us, from a security perspective, is that a lot of times we can see them sort of match up their public statements with where we see targeted attacks. In one instance, there was a group that we had with high probability targeted, associated with the Chinese government, that shortly after China had released public statements about wanting to become one of the leading cancer research areas in the world. They want to have the latest information, the greatest information. They want to be the go-to research for cancer in the world. Well, shortly after that, this group that we associate is sponsored by state actors had targeted 3 oncology companies. And they were stealing information about how the latest tests, the latest trials, what was going right, what was going wrong with this, but also business intelligence. Who talks to who? Where do they get their funding from? Who are they working with? Who are they outsourcing their information to? Do they set stuff up in Hong Kong? Where are their other areas at? So you could see sort of that direct correlation between a stated goal and then an increase in attacks against specifically that interest. So 3 things that companies are doing, the 3 types of attackers, and then lastly, did you have a question? I'm sorry. Oh, jump on in. Well, it's a good thing for us because we could sort of, yeah, bad use of terms, but a good use in the sense that we can get an understanding of maybe where their focus is going to be in the future and work to educate companies in those industries to sort of give them real information on why they might be targeting. So it's one thing for a vendor to come up and say, hey, you guys might be targeted, here's my business card, call me. It's another thing to say, hey, look, historically we had seen China target the manufacturing industry because of this. We had seen that they're increasing their targeting towards healthcare because of these public statements. So let's talk about what you guys are doing and how we see attacks targeting that sort of, like the oncology information. So we see something, yeah, exactly. So lastly, sort of the 3 things that companies are doing to sort of up their security. The first one, 2-factor authentication. All of those things that we talked about, the attackers clicking on links or the attackers trying to get login and passwords, all of that would have failed with good 2-factor authentication, because even if you had your login and password, if you have a PIN on your phone that you need to enter, the attackers wouldn't be able to get around that. So the second thing would be sort of sandboxing, some way to go back to the malware analysis to be able to understand what the malware is doing before it actually gets onto your network, some way that you can automate the analysis and sandbox the analysis. And the third one is practicing your preventative, but also the detective measures within your company. So there was a good quote that one of our execs had said that, you don't need to pay to see if you're vulnerable, if there's an intrusions going on, because you get a free vulnerability scan every day on the internet. So anytime you find out if you're vulnerable by finding if people are in your network. But testing your preventative, so would you be able to identify an attack if it came after you? How would you be able to prevent it? But then secondly, getting to the point that was mentioned previously, if they were in your network, how would you be able to detect it? So say they got past your security, now what would you be able to do at that point? Would you be able to detect it? Would you be able to identify how they move laterally throughout a network? Or would you be able to identify malicious emails being sent to other people? Or would you be able to identify these people accessing the server when they really shouldn't have access to? So those were the 3 areas that I wanted to cover during the presentation. I think we'll have time for Q&A. But either way, I really appreciate your time and attendance, and thank you for having me here today.